Welcome to our special broadcast tracking COVID-19. In the next half an hour, we'll get you all the updates related to COVID-19 and also how Prime Minister Narendra Modi highlighted and ways to tackle COVID-19 pandemic. First, start with the headlines. Prime Minister Narendra Modi participates in non-aligned summit on tackling COVID-19 meeting via video conferencing, calls on NAM countries to remain inclusive in their efforts against the epidemic, hails India's democratic model, says democracy, discipline, decisiveness have come together to create a genuine people's movement. PM Modi says even as the world highlights COVID-19 virus, some people are busy spreading other deadly viruses such as terrorism, fake news and doctored videos to divide communities and countries. Government to bring Indians stranded abroad back home in a phased manner from May 7th. Return to be on board airplanes and naval ships currently abroad. Indian embassies and high commissions to prepare list. Railways are not charging any fare for Shramik trains from workers who are seeking to return to their homes during the lockdown. 85% of charges being borne by railways. State governments expected to pay remaining 15%. No open sale of tickets as state governments to decide who can travel. Active cases of COVID-19 in India stands at 32,138, while 12,726 have been recovered and discharged and 1,568 casualties recorded so far. Government engages civil society, NGOs, industry and international organizations in the fight against COVID-19. And coronavirus cases increase rapidly worldwide. So far, over 35 lakh people have been infected with coronavirus. More than 2,51,000 people have died. More than 11,78,000 people infected with COVID-19 in America, with more than 69,000 fatalities in the US alone. Let's first take stock of the developments in India in Ground Zero. So as the world is fighting against the COVID-19 pandemic, various organizations are joining hands to carve out solutions to come out of the global health crisis. Prime Minister Narendra Modi participated in non-aligned summit on tackling COVID-19 meeting via video conferencing. PM called on NAM countries to remain inclusive in their efforts against the epidemic and hailed India as a leader as humanity faces its most severe crisis in many decades.
NAM should call upon the international community and the World Health Organization focus on building health capacity in developing countries. We should ensure equitable, affordable and timely access to health products and technology for all. We should develop a platform for all named countries to pool our experience, best practices, crisis management protocols, research and resources. Excellencies, in the founding spirit of movement, let us aim today to come together, not grow apart. Each of us can be saved from the pandemic only if we all are. Let us work as partners towards an inclusive and cooperative global response.
And PM Modi said even as the world fights COVID virus, some people are busy spreading other deadly viruses such as terrorism, fake news and doctored videos to divide communities and countries.
are busy spreading other deadly viruses such as terrorism, such as fake news and doctored videos to divide communities and countries. But today, I want to focus only on the positives.
Right, so India talked about its democratic model on COVID containment at non-aligned movement NAM meeting. PM said India has shown how democracy and discipline can come together to create genuine people's movement.
During this crisis, we have shown how democracy, discipline and decisiveness can come together to create a genuine people's movement.
Now let's take a quick look at the top 10 takeaways of Prime Minister Narendra Modi's address in the NAM meet. We'll show you through graphics the 10 main points of his address. Here you go. PM slammed Pakistan without naming it at the non-aligned movement meet. He said, even as we fight COVID virus, some people are busy spreading other deadly viruses such as terrorism, fake news and doctored videos to divide communities and the countries. So India has promoted coordination in immediate neighborhood on COVID. So NAM can help promote global solidarity and it has been world's moral voice. So he also said that NAM should call on international community and WHO to build health capacity in developing countries. And he also said that let us aim to come together, not grow apart. We have sent medical supplies to over 123 countries, including 59 NAM members. And he began with paying condolences to all those who lost loved ones due to COVID-19. Says humanity faces its most serious crisis in decades. He also said that we need a new template of globalization based on fairness, equality and humanity. And he mentioned that we need to promote human welfare and not focus on economic growth alone. So many countries organize military drills, but India has taken the initiative to organize disaster management drills. Now moving on, Prime Minister Narendra Modi also highlighted India's efforts in combating COVID-19 pandemic.
India's civilization sees the whole world is as one family. As we care for our own citizens, we are also extending help to other countries. To counter COVID-19, we have promoted coordination in our immediate neighborhood and we are organizing online training to share India's medical expertise with many others. India is regarded as a pharmacy of the world, especially for affordable medicines. Despite our own needs, we have ensured medical supplies to over 123 partner countries, including 59 members of NAM.
And also active cases of COVID-19 in the country have reached 32,138. 12,726 people have cured and discharged, while 1,568 people have died due to the virus so far. Maharashtra continues to be the hardest hit state with total of 14,541. Gujarat has reported 5,428 and Delhi 4,549 cases so far, and with more than 500 cases reported yesterday, total number of cases in Tamil Nadu have crossed 3,500. And briefing media yesterday, Health Ministry informed that 1,074 patients cured from the disease yesterday, and Ministry also informed that the recovery rate stands currently at 27.52%. Moving on, as we have entered the third phase of the lockdown, government is now working towards facilitating the return of Indian nationals stranded abroad. The operation will be conducted on compelling grounds in a phased manner. The operation will begin from May 7th. So the travel would be arranged by aircraft and naval ships. A standard operating procedure has already been prepared. Indian embassies and high commissions are preparing a list of distressed Indian citizens. This facility would be made available on payment basis, and non-scheduled commercial flights would be arranged for air travel, and the passengers will be screened before they board the flight, and only asymptomatic passengers will be allowed to travel. And also, upon reaching, everyone will have to register on the mobile application, which is Arogya Setu app. They will be screened once again, and after the screening, the passengers will be quarantined for 14 days. They will be kept either in a hospital or in an institutional quarantine, and another round of tests would be done after 14 days, depending upon what further action would be taken according to health protocols. The Ministry of External Affairs and Civil Aviation would share detailed information about it through its websites, and state governments have been advised to make arrangements including testing, quarantine and further movements of the returning Indians in their respective states. So moving ahead now, West Bengal has the highest COVID-19 mortality rate in the country at 12.8%. Inter-Ministerial Central Team Leader Apurva Chandra wrote in his final observations to State Chief Secretary Rajiv Sinha before leaving for Delhi on Monday. Apurva Chandra said in the letter that this extremely high mortality rate is a clear indication of low testing, weak surveillance and tracking. He further added that a discrepancy has been brought to the fore in the number of COVID-19 cases reported by the state in its medical bulletins and its communication with the union government. The team led by Chandra returned to the national capital after having completed 2 weeks of stay in Kolkata. Now, railways are running special Shramik trains on the request from concerned state governments for sending and receiving stranded persons, but politics has started on return of stranded labourers. Reports of stranded labourers being charged for their fare of return journey home from different states has led to political slugfest, with Congress offering to pay for the tickets of migrant workers. The centre has, however, clarified that railways are not charging any fare from workers who are seeking to return to their homes during the lockdown. 85% of charges being borne by railways. State governments are expected to pay remaining of the amount, which is 15%.
हमारी गाइडलाइंस ने क्लियरली कहा है कि इंफेक्शियस डिजीज मैनेजमेंट के भाग के रूप में जो मनुष्य जहां है वहीं रहे। स्टेट की रिक्वेस्ट के तहत उन लोगों को स्पेशल ट्रेन चलाने की हमने परमिशन दी। गवर्नमेंट ऑफ इंडिया हो या रेलवेज हो, किसी भी कोशिश में हमने कभी भी कोई भी वर्कर से चार्ज करने की बात नहीं की है। हमने 85% जो पूरी ट्रांसपोर्टेशन का कॉस्ट बियर किया जाता है, वह 85% जो है वो रेलवेज बियर करती हैं, 15% स्टेट को बियर करना है, और उसी प्रोसेस और बेस्ड ऑन स्टेट्स रिक्वेस्ट जो ये प्रोसेस शुरू हुआ है कि जो कुछ लिमिटेड पैसेंजर, जो स्टैंडर्ड पैसेंजर्स हैं, माइग्रेंट लेबरर्स हैं, जिनको लिमिटेड लोगों को लेके जाना है फॉर सम वेरी पर्टिकुलर रीजन, उसको स्टेट गवर्नमेंट उसी तहत में कोऑर्डिनेट भी कर रही है, एक्सेप्ट फॉर 1 or 2 states.
Right, so BJP has attacked the Congress on this issue and alleged that Congress was playing politics over such a sensitive issue, and several states like Andhra Pradesh, Telangana, Bihar and Madhya Pradesh have talked of bearing the entire cost, while there are some states who have not yet taken any decision in this regard. While Kerala government has said that those who can afford it should be charged for the travel, Bihar and Madhya Pradesh chief ministers stated that their governments will bear the expenses of the workers returning home. Moving on, the Khadi and Village Industries Commission on Monday said that it is contemplating legal action against companies selling personal protective equipment kits by fraudulently using Khadi India brand name. The KVIC has clarified that it has so far not launched any PPE kit in the market. KVIC chairman Vinay Kumar Saxena said that KVIC has developed its own PPE kit made of Khadi fabric, which is at various levels of testing. At present, KVIC is only manufacturing and distributing specially designed Khadi face masks that conform to the highest safety standards. KVIC is using double twisted khadi fabric for manufacturing of these masks, as it helps retain 70% of the moisture content inside. Further, these masks are made of hand spun and hand woven khadi fabric, which is breathable, washable and also biodegradable. Some good news now. Even during this time of crisis, news filled with goodness are coming from around the country. Let's have a look at good news. So the nationwide lockdown has sent educational institutions across the country to hibernation for a long time. However, HRD Ministry has taken several steps to keep students and also teachers on track through online classes and training. Rajiv Gandhi University in Arunachal Pradesh is keeping updated through webinars and online classes. Let's have a look.
As the fight against COVID-19 continues in the current situation, universities and colleges are making the use of internet and digital technologies as one of the top priority for their teachers and students. Government is also emphasizing on training and skill development of teachers in the digital tools. A few days ago, faculty members of Rajiv Gandhi University and different colleges were assembled for a webinar, but this time through digital tools and use of laptops.
Yes, ma'am, you can ask your question.
First of all, it was very informative and very, I think it's very helpful. The whole lecture was very...
The system of webinar has now become very important in the midst of COVID-19 crisis.
During this lockdown, we are unable to have face-to-face contact with the students. So we are facing very difficult in teaching learning process. We got very good response from all over the India. And not only from India, we have participants from Dubai also and Malaysia. 2 participants from Malaysia and 1 participant from Dubai. The objective of this program is to make the teachers learn how to take class with the participants, with the students, without face-to-face mode.
If we stop learning, either the teachers or the students, it will be disastrous to the whole society. So we thought of learning to continue even this is distress, and that's why we have contextualized this kind of workshop. We have organized this workshop on the faculty development program to equip our teachers, to skill our teachers to better use this online platforms.
Sanjay Pratap Singh, DD News, Itanagar.
Moving on now, DRDO has developed an ultraviolet disinfection tower for rapid and chemical-free disinfection of high infection-prone areas. The equipment, named UV Blaster, is a UV-based area sanitizer designed and developed by Laser Science and Technology Center, the Delhi-based premier laboratory of DRDO. The UV Blaster is useful for high-tech services like electronic equipment, computers and other gadgets in laboratories and offices that are not suitable for disinfection with chemical methods. The product is also effective for areas with large flow of people, such as airports, shopping malls, metros, hotels, factories, offices, etc. Now moving on, 443 flights operated under Lifeline Iran by Air India, Alliance Air, IAF and private carriers. Cargo transported till date is around 821 tons, covering over 4 lakh kilometers. Lifeline Iran flights are being operated by Ministry of Civil Aviation to transport essential medical cargo to remote parts of the country, with special focus on the northeast region, island territories and the hill states. Helicopter services including Pawan Hans Limited have been operating in Jammu and Kashmir, Ladakh and northeast region, transporting critical medical cargo and patients. Pawan Hans till 3rd May 2020 have carried 2.27 tons of cargo, covering a distance of 7,729 kilometers. A cargo air bridge was established with East Asia for transportation of pharmaceuticals, medical equipment and COVID-19 relief material. Now in Uttar Pradesh, Rampur, the district administration has come out with a unique initiative of deploying several mobile medical stores on e-rickshaws in order to provide residents with door-to-door medicines and essential items. The move will also aid in curbing unnecessary public movement on roads. The initiative is being carried in Rampur's Tanda region after a huge number of cases were registered in the area and people were advised to avoid any kind of unnecessary travel. The move, in addition to providing facilities to residents, is also proving to be a method to provide the e-rickshaw drivers with employment. And let's now scan through the developments from across the globe in a world wrap. So the global death toll due to the virus crossed 2.5 lakh mark with a total of 35,84,118 cases reported globally. Meanwhile, countries are gradually coming back to activity after a considerable spell of dormancy while ensuring that proper measures are in place to avoid further spread of the virus. In USA, senators returned to Washington for the first time in nearly 6 weeks amid concerns that their legislative sessions could put lawmakers and staff at risk of contracting the new coronavirus. With the resumption of the Senate, party leaders raised partisan differences over the next step in how to combat the pandemic. Democrats and Republicans are at odds over the contents of any new coronavirus legislation. While Democrats want up to $1 trillion to help state and local governments, the Republicans, on the other hand, are demanding liability protections for businesses as a condition for moving forward on any bill. With Washington still under a stay-at-home order, lawmakers were advised by the congressional physician to wear masks, stay 6 feet apart and limit the number of staff on Capitol Hill. Meanwhile, in New York, the City Metropolitan Transportation Authority workers disinfected trains during the coronavirus pandemic as the city struggles to keep the virus at bay. New York City's subway is taking the unprecedented step of halting overnight service in order to clean train cars, a likely prelude to bigger changes as the largest U.S. mass transit system works to rebound from a pandemic that has slashed ridership. The city has been the nation's epicenter in the pandemic. The U.S. coronavirus tally now stands at 11,80,634 coronavirus cases and 68,934 deaths, with New York alone registering 19,057 deaths. France now. French Finance Minister Bruno Le Maire on Monday said that France is expecting to face risk of companies going bankrupt and job cuts as the country readies to ease its coronavirus lockdown measures next week. Speaking at an online event, Le Maire said an uncertain resuming of operations could hamper companies' return to normal as France is slated to put in place its deconfinement plan starting May 11th. Le Maire singled out restaurants, the tourism and cultural industry and other businesses that will remain closed after May 11th, saying that they should be the priority beneficiaries of the nation's generous partial unemployment scheme. The France coronavirus tally now stands at 1,69,583 coronavirus cases and 25,204 deaths. An update of UAE now. UAE has recorded an additional 567 cases of COVID-19 in the country, bringing the total number of cases in the country to 14,730. Official spokesperson of the UAE government said that further 18,698 tests were conducted across the country. She also informed that 203 more patients had recovered from COVID-19 after receiving the necessary medical care, raising the total number of recoveries to 2,966. Officials also announced 11 new deaths of people from different nationalities, bringing the number of COVID-19 related deaths to 137. Meanwhile, Saudi Arabia reported 1,645 new coronavirus cases and 7 new deaths, raising the total number of cases in the kingdom to 28,656 and the virus-related death toll to 191. Moving on, Bengaloreans from the age group of 4 to 70, that means from small children to aged people, have come together in chorus with a song of hope. Their peace medley recorded by each one of them in the safety of their homes. Their aim is to soothe people's anxieties and strengthen the resolve in these trying times. We leave you with the song of hope. Namaskar.